Hello.
Good morning.
Good morning, everyone. Let's continue our discussion about social justice from last week. Who can remind us what social justice means? Jason?
It's the concept where all individuals and groups in a society get fair treatment and benefit equally from society.
Good. How about a little more? Tiffany, go ahead.
Social justice is more than a focus on people. It's a focus on community, government, society, etc., to see what can be improved or created so everyone gets fair treatment.
Good. Today, I want to discuss how health disparities exist in our society and how this relates to social justice. Yes?
What does health disparities mean specifically?
Anyone? Jason?
Well, it means how diseases affect different populations in unfair ways. Certain kinds of people get sick or die more often than other groups do. Diseases and other health problems don't affect everyone equally.
Exactly. What kinds of things, what factors in society might make different groups experience different kinds of health problems, or different frequencies of certain health problems, or different severities or consequences of different health problems? Julia?
Money. People who are poor don't get good health care, or can't afford healthy food, or can't afford vaccinations to prevent diseases.
What else?
Education differences? People with limited education might not know as much about preventing disease.
Right. Good. Yes?
I read that heart problems in women are often overlooked. Maybe being male or female relates to health disparities.
Yes. There's a lot of research on that. Yes?
Another is race and ethnicity. For example, I know that African Americans are more likely to die from heart disease than white people.
There's also a lot of research showing that race and ethnicity relate to health disparities. Jason?
It seems like genetics might also relate to health disparities. For example, people with light skin tend to get more skin cancer. That's not discrimination, it's just biology. Maybe certain races or ethnic groups are more prone to certain diseases for genetic reasons.
That's a good point. We'd call that a health inequity. But unequal treatment or unequal opportunities between groups also could be a factor causing health disparities. When we think about health disparities and social justice, we need to consider all the possible factors that could cause health differences. That's why people do health disparities research, to learn how to correct or prevent health disparities by examining factors like these very carefully. Yes?
What about deaf people? Do we have health disparities that affect us?
Well, remember, the deaf population is made up of many subgroups. People who are born deaf, people who lose their hearing in old age, people who sign, people who don't sign, people who are deaf for genetic reasons, people who are deaf for other reasons, and so forth. There isn't just one deaf population. There's many.
Wow. Just think of all the different deaf populations within the deaf community that researchers would have an opportunity to examine.
Right. Unfortunately, there's very little research on health disparities in any deaf population.
If social justice is important, deaf people should be included in health disparities research.
Sorry, I didn't see you. What did you say?
Oh, I said if social justice is important, then deaf people should be included in health disparities research.
Yeah, I understand your feelings. I feel the same way. What little research there is shows that adults who were born deaf or became deaf early in life have worse health than the American population in general. However, a lot more research would be needed to understand more about this. Compared to the amount of health disparities research that's been done with these groups, extremely little has been done with deaf people.
That situation isn't right. It's a big opportunity for improving social justice.
Right. Let's brainstorm together. Why might deaf people be at higher risk for health disparities than hearing people? For now, let's focus on people who were born deaf or became deaf very young. People like you, who are sign language users. What barriers do deaf people experience that might create health disparities? Martina?
Well, like you said, if there isn't enough research about deaf population health, then scientists and government won't know what the problems are or what to do about them.
Right. No data. That's a huge problem. Why do you think scientists don't have much data on the health of deaf people? Julia?
My mother told me she got a telephone call that asked her lots of questions about her health, my mother's hearing. She said it was a research survey. Researchers probably don't know how to contact deaf people, like with video phones or TTYs, so deaf people are left out of telephone surveys.
That's a good point. A lot of research is done using telephone surveys. Jason?
Researchers also send questionnaires through the mail, but they're in English, and many deaf people are not skilled in English.
Right. Does anyone know the average reading level of deaf high school graduates in the United States? About 4th grade.
Wow, that means most deaf people won't understand the complexity of the language or the vocabulary in health research surveys.
Sad, but true. Yes.
So, if we don't have health data from deaf people, then we don't know what the problems are. Scientists can't decide what are the most important health disparity problems to work on?
And without health data from scientists, other people can't design effective health education and health intervention programs for deaf people either.
Exactly. All this relates back to the lack of health research data on deaf people. What other barriers can you think of that might lead to health disparities in the deaf population? Julia?
There are barriers to getting good health care. Most deaf people I know aren't satisfied with their communication with their doctor.
Yeah, there are only a few deaf doctors or hearing doctors who sign fluently. Some doctors refuse to hire interpreters, and many don't take the time needed for good communication.
Language barriers lead to health disparities for many groups who don't tend to use English. Research with these other groups, like people who speak Spanish, shows that improving communication with doctors helps them follow doctors' recommendations better. Following doctors' recommendations is good for anyone, but it's especially important for people who have chronic diseases like asthma, diabetes, or some lung and heart diseases. Yes, Tiffany?
And if communication is better, maybe doctors can detect health problems earlier, instead of waiting until a health problem, like cancer, becomes really serious.
Right. Communication is so important.
This is related to communication. What about problems many deaf people have understanding health information, like in magazines or the web? Many deaf people already have limited reading skills.
Understanding medical vocabulary is hard for a lot of deaf people, even me sometimes, and I'm a college student.
Well, that's a common problem in groups that aren't fluent in English. Not understanding medical words or expressions or concepts like medicine side effects could lead to health disparities. We call that health literacy. Yes?
Many deaf people may not know much about their family medical history, but doctors ask questions about it all the time. I don't know much about my family's medical history, and my doctor always seems surprised.
Why is your doctor surprised?
He expects me to be like a hearing person who overheard my parents talking about our family's medical history when I was growing up. My parents can't sign. Our communication is limited. The doctor doesn't realize that. My younger sister and I were talking about this recently. She's hearing. She signs pretty well. And I couldn't believe the things she knew about our family's medical history that I didn't. She said she learned it all at the dinner table during conversations. I was usually left out of all of that.
Also, hearing children can hear what their parents say when they talk to each other about your health, or when they talk about you in front of doctors and nurses. Deaf people miss out on that information about their own health.
Yes?
I'm wondering, I know that some diseases are more common in deaf people than in hearing people, like Usher syndrome, just because of genetic reasons.
Yes. We need a lot of research on diseases that might be linked to hearing loss itself for genetic reasons or other reasons, like people who become deaf because of rubella, or meningitis. Martina?
I bet if the average deaf person and the average hearing person had the exact same disease, let's say diabetes or some genetic disease, I bet that the deaf person's health would eventually be worse than the hearing person's.
Why?
Because of all those barriers put together. Even with the same disease, the average hearing person doesn't experience the same challenges with communication and reading. And there may be better scientific data about hearing people with that disease. And also those other factors we listed can affect deaf people. Lower income, less education, things like that.
Okay. It's time to stop. This has been a great discussion. And you all are right. Deaf people are at higher risk for health disparities. And that is a real social justice issue. Now, for next week, I want you to think of 2 ideas that would reduce these barriers. Pretend you're writing a letter to some high-up public health official. Come up with 2 recommendations for them. Things that politicians or scientists, public health workers, and so forth could do to improve deaf people's health. Send me your papers by Monday. Okay? See you next week.